Hello, and how are you? Welcome to another session on health policy, and we're going to check on the health policy review process. If you're new here, my name is Winnie Barawa, and this is a channel that focuses on lectures, lessons, and expert interviews pertaining to healthcare. Under the healthcare policy, we've done different segments touching on the basic concepts regarding to health policy, the health policy cycle. We've checked out the health policy triangle. And in the health policy review process, we want to understand how or why the process happens sometimes and what should be the final product. So don't forget to subscribe if you've not yet done so. And don't forget to leave a comment or a review of our work. We really appreciate your feedback and also appreciate your ideas as we keep on improving on our work. So let's keep on and understand what the health policy is. So the health policy review process is most of the time contributed to by different reasons or different purpose. And one of it is if the policy is no longer being followed or the policy basically, is not being used or being taken into consideration. It could be time has passed, things have changed, and therefore the individuals or the organization that applies this policy is no longer using it. Then there's the policy is no longer effective or having an effective impact. So what happened is we need to appreciate that with changes and different situation, the policy that we had developed previously may not be effective and it may not be making any impact in that particular area. So there might be need to make reviews for that regard. And then these new issues might have arisen that mandate the policy to be amended. And this brings us again back to the changes that as time passes by, we realize that policies needs to be changed because issues are changing, different situations are coming into play, and so there's need for review of these changes to cater for the different aspects. And then they could be changed to the mother policy, which make the existing policy redundant or non-compliant. So remember when we are discussing the review of the policy cycle, we discussed about a place where what makes a policy complete is that a policy is not just a one main segment, it's made of sub-segments which discuss different parts of this policy. So sometimes the mother policy or the main part of the policy might have changed, and this now, facilitates or necessitates the other parts of this policy to be reviewed because they will have become redundant or they are non-compliant to the new changes in the environment or to the new changes that have occurred in the community. So in here, we are looking at the review steps or policy review steps. So we are going to look at 7 steps, starting with step 1, what we'll be evaluating on the need analysis. Need is what are the changes or what are the areas that we want to focus on or we are going to see in this policy that need change. And then we have step 2, that is researching. Then we have step 3, that is about drafting or coming up with the first draft. And then we have step 4, consultation. Step 5 is about approval. And then we have step 6 that looks into implementation and communication. And the final step is step 7, which focuses on maintenance and review of the policy. So we will in this stage of stage 7, there is the aspect where we decide if we are maintaining the policy as it is or we keep on with the review process. Starting with the first stage, that is step 1 of need analysis. Here we are being told that in the policy review stages, the policy custodian are able to identify the issues that are triggering the policy review, and then we can decide whether we are going to log for a later day or for a later review day, so that you can be able to create time for analyzing more of this policy before we decide on the changes. So you log for a later review date. But then we have the option of having identified the issues that needs to be reviewed. We can address these issues through alternate options or other alternatives, or we can just proceed straight for the review process. So the basic part is doing the need analysis. Identify the issues in the policy that need the review process. We can look at possibly the change in the mother review, in the mother policy. We want to see the changes that have occurred and that has rendered this policy maybe redundant or non-compliant, or generally, like we said, is the policy being not followed at all. So what are these parts in the policy that have changed, that are no longer meeting the needs of the population? So in this regard, now we keep a decision of, do we do it later, or do we address it through other methods, or do we proceed for a whole review process? So that's the first stage. But in the second stage, that is the research. So in the research stage, the policy custodian are now able to sit down, analyze the relevant information that can help inform the review process. So in the research process, we are going to do data analysis, literature reviews, and the best practices that should be done to review this process or to review the policy. So what happened is, because here we want to be comprehensive, we want to be in-depth, we want to cater for each and every aspect of the policy. So in this stage, there is data analysis, meaning we have identified the needs that needs to be handled in this policy. And so in this case, we are going to analyze each and every nitty-gritty that is key or is a key component of this health policy that needs to be reviewed. Then we're able to do literature reviews. Literature review is going to help us compare and contrast similar policies that had gone through a similar process of review, and what were the approaches or ways that were adopted to help in making it better. And then we can see the best practices that can be done as we are doing this health policy review. Then with this, we can check out on the implication of the policy review on other policies with the stakeholders and the system. So remember, this is having literature review in it, it's having the best policy approach in it. So in this case, after doing the research, you don't just leave it there. You want to see what does research say if this policy is reviewed? What are the impact or what is the implication that can come out from changing this policy? Is there maybe an effect on other policies? Is it going to affect even the stakeholders? Remember, stakeholders by definition could be individuals or organizations that have a direct or indirect interest in this health policy that we are dealing with. So if we do a review of it and we make some major changes in it, does it mean maybe some health stakeholders might not be interested in this health policy again? Or does it mean the systematic management of it might also be affected? For example, does it mean you will need to change the organogram or the management system for this particular health policy or for the particular health ministry that has been affected in this case? So research helps us to bring into light the many factors that can be affected or the many things that can affect the change after that. And then now in step 3, which is drafting. So in the drafting here, we are not going to do it alone. We are not going to welcome stakeholders or individuals, leaders, or organizations that have an impact on this policy or have an interest in the policy that we are planning to review. So what they will do is stakeholders have different knowledge and technicalities that can contribute to making the policy better. So normally we are required to contact them and give them an opportunity to comment on the draft. So we can organize stakeholder engagement, we can organize stakeholder participation, and they'll come together and give input pertaining to the draft of the policy so that they can tell if there are certain parts that have not been included, or they can comment if there are certain areas that are not as inclusive as you will expect them to be. So with the stakeholder engagement, they bring in more technical expertise that the individual review team may not have been inclusive of. But at the end of the day, when these stakeholders come in, they give us a more well elaborated health policy that is ready to, adopt to the changes that are in the environment or are occurring in the population. And in the step 4, which is now on consultation. So remember the engagement of the draft here. We are not in the final part. So the next bit is to consult again. So in this case, as earlier identified, the stakeholders that were consulted regarding the policy and they were asked to bring in their inputs in the different parts of this stakeholder or in the different parts of their roles, you can still consult them to give more input in regards to, what could be the challenges that can face this particular health policy as you're trying to implement it or as you're trying to communicate it to the population. So the consultation might depend on different components. We may not now be consulting on the whole policy at this particular stage. We might be consulting the stakeholders for specific parts. However, at this stage, you need to be considerate that you may not be able to consult all the stakeholders. You may just be able to consult a few to give input on very specific parts of the health policy that needs to be consulted on. The main consultation was through the draft, where you have to engage all the stakeholders and hear their inputs regarding the policy. But now in the consultation stage 4 here, we are not like focusing on all of them. We just call on specific that we know will have a key input in the parts that are needed. Like, will there be constraints or challenges that can affect the health policy we are trying to implement it, or you want to look at cost implications, so you'll be calling on specific stakeholders on this. And then we get to look at step 4, that is approval. So on approval, here is where the final draft is being submitted for approval by the highest authority or management, and this will accompany by communication and implementation plan. So depending on the ministry where one is working or depending on the area where we are doing the health review, there'll always be the topmost management that is bestowed with the role of doing final decisions and giving the final say in the health policy. So in this case, the approval of the policy will now be pegged onto the final authority, who will now come in to give their final input, who will now come in to give their final thoughts and either to approve or to return that document for further discussion. And as we are doing this, we are required to accompany that health policy with, the communication plan and the implementation plan. And in step 6, we are looking at communication and implementation. So in the communication, this is the stage where the policy is looking at how should it be implemented, and you have a clear record maintained against communication and implementation log frame. So how do we do this? So in the policy, it should be clearly stated how this policy shall be implemented, and also in this implementation, how is it supposed to be done? So here you can state like what is the budget implication, the cost, who is supposed to fund all this, and then like how are the roles and responsibilities, how is the reporting process. Like you need to bring in check, or we need to clearly communicate how all this is going to work. So step 6 brings out communication and implementation of this policy. How are we going to reach out to the public in regards to implementation of this policy? Because yes, we are making a policy review, but this reviewed policy will actually be effective on the population. And how are the population going to hear about it? Are we going to use media? Are we doing community engagement? Are we going to have dialogue? And in doing that, how are we going to implement it? So the how has to come out. And in this how, there is now the need for generating an implementation log frame that shows all the different ways and activities that are going to be done to ensure that the health policy that has been reviewed is properly being communicated and implemented in the population. And the final step is step 7, where we talk about maintenance and review. So we are told as the implementation process is ongoing, there's usually a need to ensure that the policy is being followed. And as we are trying to ensure that the policy is being followed, it's therefore necessary to audit the compliance or evaluate the policy. So this now brings us to the stage where in the health policy cycle, there's the aspect of monitoring and evaluation. So in the auditing of the health policy, here we are able to see if the policy can be maintained as it was, or we can keep on review and make key changes in this health policy. So it's a very major step that is going to help us make key maneuvers or make key inputs that we feel may not be or might be needed due to the observation that we're able to audit in the compliance levels of that policy. And after reviewing the policy, the different outcomes that we can generate, we can have a state where there are no need for changes to be made. So this is a stage where maybe we have done the review, we have done the research, we've done need analysis, and we see that actually there's no need to make any change into this policy. But also after the whole process, we might opt for very minor amendments that can be made. And then in some status, we can have major amendments being made. But in other cases, we can have that the policy is revoked as it is, so it's no longer required. So in the final case where we are saying we are doing policy revocation, in revoking the policy, it basically means that policy is outdated. Even if it gets changed, it may not meet the needs of the population. So you may just decide to, revoke it and just not make any changes to it again. So it's no longer required. These are our references if you wish to read more or study more about health policy and health policy review processes from one stage to the other, and if you want to understand more. And we always encourage us, you can always don't forget to give us a like, leave a comment, share your views on this, but also share it in your platforms, like get to share these videos on your platforms. And if you've not yet subscribed, please give us or click on the subscribe button. So thank you so much for staying with us all the way to the end. Until we meet again in our next lessons. Bye bye.